Welcome to the third session of Human Health and Disease. In this session, we will mainly discuss topics like AIDS, cancer, drug abuse and alcohol abuse. So, we are beginning with AIDS. The word AIDS stands for Acquired Immunodeficiency Syndrome. AIDS was first reported in 1981 and in the last 25 years or so, it has spread all over the world, killing more than 25 million persons. AIDS is caused by a retrovirus, and this retrovirus is known as human immunodeficiency virus. Retroviruses, they usually have RNA as a genome, and from the RNA they are making a DNA. So, whenever from RNA a DNA is made, that is called reverse transcription. So, retroviruses, they are capable of reverse transcription. HIV is also capable of this particular process. Here, structure of HIV is given. In this structure of HIV, you can see it is considered to be an enveloped microbe. It is an enveloped virus. Why it is called an enveloped virus? Because it is being covered by a bilipid layer, and you can see some glycoproteins on that envelope. It is very important to note the glycoprotein 120 and glycoprotein 41. These two glycoproteins you can see on the surface. That is why they are very important, because they are involved in formation of a complex with the host cell. These glycoproteins, you can say they are involved in attachment of HIV with the host cell. And within this HIV, you can see two RNAs. So, here you can see the nucleocapsid. So, two RNAs are shown here. This reddish colored, that is a reverse transcriptase. So, you can see a matrix as well as a capsid here. So, this is the structure of HIV. Now, how HIV is transmitted? HIV is transmitted by 4 different ways. First one, by sexual contact with an infected person. Second, by transfusion of contaminated blood and blood products. Third one, by sharing infected needles, as in the case of intravenous drug abusers, and also from infected mother to her child through placenta. From mother to child, there will be prenatal as well as postnatal transfer of this HIV. By prenatal we mean before birth, and by postnatal after birth. So, prenatal as well as postnatal transmission of HIV happens from mother to child. Here you can see how HIV undergoes replication. HIV selects the host cell which are having, the host cell for HIV will have specialized receptors, and these receptors are usually CD4 receptors. Macrophages and T helper cells, they are with CD4 receptors. They are the usual host cells for HIV. So, HIV undergoes replication within these host cells. So, in the process of replication, you can see the different steps as shown in this diagram. First of all, there will be fusion of HIV to the host cell surface. So, you can see the GP120 is involved in that binding with the CD4 receptor. So, after attachment with the host cell, now the viral RNA reverse transcriptase, integrase and other viral proteins that are present within HIV will enter into the host cell. So, you can see it over here. And now what happens? The viral RNA which enters into the host cell using reverse transcriptors will give rise to a DNA copy. So, this is called reverse transcription. So, now as a result of reverse transcription, there will be formation of a viral DNA. This viral DNA along with integrase will enter into the nucleus of the host cell, and within the nucleus it is getting integrated with the host DNA. So, that is a function of integrase. Integrase, using that integrase, viral DNA is getting integrated along with the host DNA. After this integration, you can see new viral RNAs, they are coming out from the nucleus, and this new viral RNA, it will be used for the genomic RNA that are found within the newly formed viruses. So, you can see here the viral RNA, it is forming the genetic material, and some of proteins are surface proteins for the virus, they are also coded by this RNA, and finally new viral RNA will be budding off from the host cell along with the protein code, it is coming out from the host cell. So, the virus will mature in this manner. Using the host cell machinery, HIV undergoes replication. So, this is happening in the T helper cells also. Now, I am going to show you a video that is related with replication of HIV. So, now in this video you can see the HIV is attaching on specialized receptors with the help of GP120. CD4 receptors found on the surface of host cell will be used for this, and you can also see a core receptor along with this, and further there will be entry of this HIV. Yes, you can see the two RNAs are coming inside, and from that RNA using reverse transcriptase, you can see a DNA copy is being made. Yes, now it becomes a double stranded DNA, and now with the help of integrase, you can see how it integrates into the host genome. Yes, you can see through the pore it is entering into the nucleus, and yes, with the help of integrase now it is already integrated with the host genome, and you can see the red colored DNA portion, that is the proviral DNA. Yes, now new RNA is formed, that is the messenger RNA, and also there is a viral RNA. These two RNAs are coming out. One will be used as the genetic material, the viral RNA will be used as the genetic material, and that messenger RNA, you can see it over here, it is used for formation of the protein code. Protease, there is involved in maturation of this HIV. Yes, now it is coming out. You can see it is budding off from the host cell. New virus, it is now budded off from the host cell. So, as you have seen in this video, it is very clear that using some special proteins on the surface of the host cell, HIV undergoes multiplication. Or there is always a time lag between the infection and appearance of AIDS symptoms, and we can call it as the incubation period. And incubation period in the case of HIV infection will be 5 to 10 years. So, it means the symptoms will appear sometimes only after 5 or even up to 8 or 10 years. It means symptoms may appear sometimes even after 5 years. Macrophages continue to produce virus, and in this way it will act as the HIV factory. Simultaneously, HIV also enters into helper T lymphocytes. You know, helper T lymphocytes are very much involved in immune responses. Helper T cells, only when they are activating the B cell is capable of producing antibodies. So, here now HIV, it is also infecting helper T cell, and when it affects helper T cell, it will affect the immune response or immune powers of a particular individual, because when helper T cells are attacked, their number will be progressively decreasing. So, the progeny viruses that are released in the blood, they are attacking more and more helper T lymphocytes, and this is repeated, leading to a progressive decrease in the number of T lymphocytes. And now it is the time for opportunistic infections. Because the T lymphocytes are very low in the bloodstream, this person is getting infected by different types of pathogens, or we can say the person is susceptible to attack of pathogens now, because the immune system is very weak. So, due to the decrease in the number of T lymphocytes, as I told you, there will be some opportunistic infections, infection of mycobacterium, viruses, fungi, and even parasites like toxoplasma. They are coming at this time because immune system is very weak. So, these infections we can call it as opportunistic infections. So, here in this picture you can see the various portions of the body getting affected by an acute HIV infection. Almost all body parts are getting affected because the person is very weak. HIV can be diagnosed by a test called ELISA. ELISA is a preliminary test for detecting HIV antigen. ELISA depends on the principle of antigen-antibody interaction. There are two types of ELISA. There is DAC ELISA and DAS ELISA. DAC, DAC ELISA, it involves direct antigen coating, and in the case of DAS ELISA, DAS, in that there is double antibody sandwich. That is another method. That is another method of detection of HIV. There is another method of detection of HIV infection. Now, in this diagram, you can see the DAC ELISA. This is DAC ELISA because in the first step, we are immobilizing the HIV antigen. From the serum that is collected from a suspected person, there may be antigen, there may be presence of antigen. So, first we will immobilize this antigen by coating it on a periplate. So, now here you can see in the second step, it is being immobilized, antigen is being immobilized. Then in this step you can see antibodies are added. Antibodies that are specific to HIV antigen will be added in this third step. So, these antibodies, because they are specific to HIV antigen, they will form a complex. You can see formation of antigen antibody complex. Now, in the third step, there is washing, and this washing will be done for removal of free antibodies. So, any antibody which is remaining free or antibodies that are not getting attached onto the antigen, if they are not finding antigen, they will be free. So, they are all washed during this particular step. Now, after this washing process, there will be adding of enzyme linked anti-antibody. So, what is anti-antibody? Anti-antibody will link with the antibody that is already there, that is already linked with antigen. So, anti-antibody linked with enzyme will be added in this step. Again there is washing, and this enzyme is peroxidase enzyme. So, after this finally we are adding a substrate or chromatogen. It is chromatogen because it is a color developing substance. This substance will develop color in the presence of enzyme. If there is enzyme, this substrate or this chromatogen will turn into a purple color. Okay. So, it is very easy. When purple color is developed, we can say the person is HIV positive, and if there is no purple color, we can say that the person is not having HIV infection or the person is HIV negative. So, how you can conclude that? Because the reaction will happen only when there is enzyme, and there will be enzyme only when the antibody is there, and antibody will be there only when that antibody is present there, and antibody will be linked on to the antigen even after those washing steps if that antigen is there. So, if there is antigen, finally we are getting a purple color as a result of the color change of that chromatogen, and if there is no antigen in that blood that we have collected, there will be no purple color. So, this is a DAC ELISA. So, this is a method of diagnosing ELISA in a preliminary stage. ELISA is not a confirmatory test. The confirmatory test for AIDS will be Western blot. The only excuse for getting HIV infection will be ignorance, and it is rightly said that don't die of ignorance. Our National AIDS Control Organization and also other non-governmental organizations, they are doing a lot to educate or giving awareness to people regarding HIV infection. The steps taken by World Health Organization is also worth mentioning. World Health Organization, they have started a number of programs to prevent the spread of HIV infection. And the steps are, they are making blood safe from HIV. They are ensuring use of only disposable needles and syringes in public and private hospitals and clinics. And also they are doing free distribution of condoms. They are controlling drug abuse, because drug abuse is also a way of transmitting HIV. Then advocating safe sex and promoting regular checkups for HIV in susceptible populations. So, these are all steps taken by World Health Organization. Now, we can go to the next topic called cancer. Cancer is one of the non-infectious disease affecting humans. Cancer, you can say that more than 1 million Indians suffer from cancer, and a large number of them die annually. Normal cells, they have regulation in their growth, differentiation and development. But in the case of cancerous cells, all these regulatory mechanisms of cell growth, cell differentiation, all are lost. So, in the cancerous cells, there is a breakdown of all the regulatory mechanisms that are involved in division of the cell, growth of the cell and differentiation of the cell. Normal cells are characterized by a property called contact inhibition. What is contact inhibition? Here in this diagram, you can see contact inhibition being explained. Suppose we have normal cells in a single layer in a culture, and some of the cells are removed. In the case of normal cells, there will be a repair or there will be division of cells to fill that space, and when they have filled that particular space, the cell division will stop. So, cells replace the removed cells only in the case of normal cells, and the cell division will stop when a single layer is repaired. You can see here, this is for the normal cell. Now, what about the abnormal cancerous cell? In the case of cancer cells in a culture, they will continue to divide and they will pile up. They will, even if there is no space, they will continue to form more and more layers. So, that is the nature of cancerous cells, because cancerous cells, they have lost that property which is found in normal cells. Normal cells are characterized by contact inhibition, but cancer cells have loss of contact inhibition. Tumors can be classified into two types: benign tumor and malignant tumor. What is benign tumor? Benign tumors, they remain confined to their original location. They are not spreading, they are not making harm for that individual. But in the case of malignant tumors, it will spread. It is spreading to different locations of the body. So, malignant tumors are considered to be cancerous, or we say that they form neoplastic cells. So, neoplasm or new cytoplasm, which is harmful for our body, will be formed only by cancerous cells or malignant tumors. So, here some characters are given. Benign tumors, they confined, remember, they remain confined to their original location and they are not spreading. But in the case of malignant tumors, they proliferate to form neoplastic or tumor cells, and they divide rapidly, they invade and damage the surrounding tissues. Malignant tumors are characterized by a phenomena known as metastasis. What is metastasis? Here in this diagram, you can see there is in a particular region of the connective tissue, a primary tumor is formed, and from this primary tumor, you can see here some of the cells are detached and they are moving through the lymph vessel and sometimes through the blood vessel. So, they can move either through the blood vessel or through the lymph vessel, and they are reaching at a different location, they are moving to a different place. Wherever they are getting lodged, they will form a new tumor. They will escape from that blood vessel or from the lymph vessel and they will reach that connective tissue and it will form a secondary tumor here. Okay. So, from the primary tumor, some of the cells are detached and they are moving through blood vessel and lymph vessel and they are forming a secondary tumor in some other part of our body. So, this is the way in which malignant tumor is working, and this process is called metastasis. So, metastasis is applicable for malignant tumors only. Cancer is caused by different factors. Sometimes physical agents are behind cancer. X-rays, UV rays, gamma rays, they are all ionizing radiations and they can damage the DNA, and when DNA or the genetic material is damaged, it will cause mutation and these mutations can lead to cancerous condition. So, physical agents can cause cancer. Some chemicals are also causing cancers. For example, in the case of tobacco smoke, there are some chemicals which are carcinogenic or that are considered to be causing cancer. Then biological agents are also there. Biological agents, because in the case of some viruses, we say they are carrying specialized genes called oncogenes, and these oncogenes can cause cancer. So, biological agents are also causing cancer. Any agent which is causing cancer can be called a carcinogen. Any agent, whether it is physical, chemical or biological, any agent that causes cancer is a carcinogen. So, now you should note that all the normal cells have proto-oncogenes or cellular oncogenes. And these cellular oncogenes or proto-oncogenes are not causing cancer. Only when these proto-oncogenes or cellular oncogenes are converted into oncogenes, it will cause cancer. How cancer is detected? Cancer can be detected by different ways. There is biopsy or histopathological study of tissue. We can take blood or bone marrow and we can analyze that tissue for cancerous cells. And there is imaging technique. There are certain imaging techniques such as CT, MRI. In the case of CT and X-ray radiography, ionizing radiations are used, and we say that they are all invasive. They are all invasive techniques. But in the case of MRI, there are no ionizing radiations. So, MRI is totally a non-invasive technique. It is not involved in a risk for the individual. So, MRI is non-invasive. So, all are imaging techniques. Now, antibodies are also used. Antibodies against cancer specific antigens can be also used for detection of certain cancers. And there are certain techniques of molecular biology which will help in detection of certain genes that are having cancer causing mutations. We can now detect cancer causing mutations directly by using certain probes. So, techniques in molecular biology is also applied for detection of cancer. So, all these are different ways of detecting cancer. In this picture, you can see a tumor associated with the pineal gland. A pineal gland tumor is shown here. Now, we are going to the treatment of cancer. Cancer can be treated by 4 different ways. There is surgery, chemotherapy, radiotherapy and immunotherapy. Surgery, of course, it is removal of the cancerous cells or tissues that are malignant. Chemotherapy or chemotherapeutic drugs, they are used to kill cancerous cells. Directly they can kill cancerous cells, but there are a lot of side effects for chemotherapeutic drugs or for chemotherapy, because it may result in alopecia or loss of hair sometimes, and it may even lead to anemic conditions. So, these are side effects of chemotherapy. Why there is loss of hair in the case of chemotherapy? Because these chemotherapeutic drugs are targeting those cells that are undifferentiated and that are rapidly dividing. So, hair follicle also contain some cells that are rapidly dividing. So, these are all targeted. Even these cells of hair follicle are also targeted by chemotherapeutic drugs. That is why there is hair loss sometimes in the case of chemotherapy. Most of cancers, they are treated by a combination of surgery, radiotherapy and chemotherapy. And some biological immune modifiers like alpha interferon, which activate the immune system, is also helping to destroy tumor. What is drug abuse? Whenever a drug is taken for a purpose other than the medicinal use, in an amount or in a frequency which alter a person's physical, physiological or even psychological functions, it is called drug abuse. Drugs, they are classified into different types. They are classified into sedatives, opioids, stimulants, hallucinogens. Now, we will try to identify each type of drug and their effects and their clinical uses. First, the sedatives and tranquilizers. Sedatives and tranquilizers usually they have a depressant effect. Examples are barbiturates and benzodiazepines. The effect will be depression of the brain activity and it will produce a feeling of calmness, relaxation, drowsiness and also deep sleep. So, these are the effects. So, we can say collectively it will produce a depressant effect. Clinical uses include hypnotic and anti-anxiety. So, for some mental disorders we are using sedatives and tranquilizers to get relief. The second category of drug we call it as opiate narcotics. Examples are opium, morphine, heroin, pethidine and methadone. The effects are shown here in this column. It will suppress the brain function, relieve intense pain both physical and mental, and it will produce a temporary euphoria. Euphoria, it is a sense of well-being, and the clinical use, it is analgesic or it is used for as a painkiller. Now going to the third category, the category of stimulants. Stimulants examples are caffeine in the very mild form, then amphetamines. Amphetamines are anti-sleep pills. Amphetamines usually used by truck drivers and overnight workers to keep away sleepiness. Cocaine and its derivatives, Novocaine, they are all examples coming under stimulants. And what is the effect? Stimulants, as the name indicates, it will stimulate the nervous system. When it stimulates the nervous system, the person becomes more wakeful, it will increase alertness, it will increase activity, and it also produces a sort of excitement for the person. And what about the clinical use? For stimulants, the clinical use will be, it is used for attention deficit, narcolepsy. Narcolepsy is a daytime sleepiness, and also for weight control. Now going to the fourth category, that is hallucinogens. Hallucinogens examples are LSD, mescaline. LSD is obtained from an ergot fungus called Claviceps purpurea. From the fruiting body of Claviceps purpurea, we are obtaining LSD or lysergic acid diethylamide. Mescaline, psilocybin, these are all natural hallucinogens. Charas, hashish, marijuana or bhang, ganja, they are all obtained from the hemp plant or Cannabis sativa. And what is the effect? Hallucinogens are supposed to alter thought, feelings and perceptions. So, sometimes people say that persons taken hallucinogen, or whenever there is a hallucination, that person will see sound and he will hear color. In the opposite manner, people used to say, because it will alter all the sensory perceptions when they are taking hallucinogenic drugs. And for hallucinogens, as you can see in this table, there are no clinical uses. Opioids are a specific category of drugs that are derived from poppy plant or Papaver somniferum. Here you can see the picture of poppy plant or Papaver somniferum, the different parts of Papaver somniferum shown here, and from the latex actually we obtain the substance called opium. So, all the opium derivatives are called opioids. Heroin is actually diacetyl morphine, or by acetylation of morphine we are obtaining heroin. Heroin is also commonly known as smack. Morphine is extracted from the latex of poppy plant. So, usually we say that opioid receptors are located in the central nervous system and also in the GI tract. And opioids, usually we say that they have a depressant effect. They depress the activity of the central nervous system, and also take the case of heroin, it will slow down the body functions. It is taken either by snoring or by injection. Now we have a category called cannabinoids. Cannabinoids are hallucinogens or psychedelic drugs which alter all the sensory perceptions. And cannabinoids in particular, these are hallucinogens obtained from cannabis sativa or from hemp plant. Here in this picture you can see cannabis sativa. So, sometimes from the inflorescence, sometimes from the leaves, from the stem, latex, people used to obtain different products of cannabis plant. And all these products, they contain a substance called cannabinoid molecule or tetrahydrocannabinol. So, whether it is marijuana, hashish, charas or ganja, all the different preparations of cannabis sativa will contain THC or tetrahydrocannabinol. And the receptors of cannabinoid is usually in the brain itself. And what is the effect? Main effect is on the cardiovascular system. Another type of drug, that is coca alkaloid. Coca alkaloids, an example is cocaine, and cocaine is obtained from coca plant or erythroxylon coca. Here you can see the diagram of erythroxylon coca. Actually, this cocaine is interfering with a neurotransmitter called dopamine, and cocaine, commonly called coke or crack, it is usually snorted, and it will produce a sense of euphoria and increased energy. And overdoses, excessive doses of cocaine, it will also cause hallucination. Cocaine, we are considering it as a stimulant, but overdosage will result in hallucination. Here two plants are shown, one is Atropa belladonna and the other one is Datura stramonium. Both are producing natural hallucinogenic drugs. Now we are going to another bad habit which will affect our body, that is tobacco smoking. Tobacco contains a chemical substance called nicotine, and nicotine is supposed to be a stimulant which is responsible for the addictive nature of tobacco. Nicotine is not considered as a carcinogen. There are some other chemical substances called tar, etc., that will act as a carcinogen in tobacco smoke. But here nicotine, it is acting as a stimulant which make the person addict to the smoking. Nicotine, how it is producing its effect? Nicotine will stimulate adrenal gland, and then from adrenal gland there will be release of adrenaline or noradrenaline. This adrenaline, it is raising blood pressure and it is increasing heart rate of the person. Smoking is associated with increased incidence of cancer. There will be cancer of urinary bladder, throat, bronchitis, emphysema, coronary heart disease, gastric ulcer, etc. Tobacco chewing is associated with increased risk of oral cancer also. And associated with smoking, there will be carbon monoxide content also getting increased. And when carbon monoxide content increases, it will reduce the amount of heme bound oxygen. What is heme bound oxygen? Oxygen molecules that are combined with hemoglobin, that is heme bound oxygen. So, this will also result in an oxygen deficiency. So, that is another harmful effect of tobacco smoking. Here in this picture you can see the various parts of human body getting affected by tobacco smoking. It is leading to, you can see, larynx cancer, oral cancer, esophageal cancer, lung cancer, emphysema. Usually chain smokers are affected by emphysema. It will lead to peptic ulcer, cancer of pancreas, gallbladder, urinary bladder, systemic atherosclerosis, myocardial infarction. So, all are common adverse effects of tobacco smoking. Adolescence is having a link with this drug abuse and alcohol abuse. What is adolescence? Adolescence is a bridge between childhood and adulthood. So, between 12 to 18 years of age we consider as adolescence, and during this phase we say that it is a vulnerable phase of both physical, mental and psychological development of an individual. So, in this vulnerable phase there is every chance of getting involved in drug abuse or alcohol abuse. So, a strong connection is there with adolescence and drug or alcohol abuse. What are the different situations leading to these bad habits? First, it will be by a curiosity or experimentation. Usually in adolescence they will have a curiosity or they will try to experiment things to escape from facing problems of late, sometimes stress from pressures to excel in academics or examinations. And also as a third point you can see some persons think that it is very cool or progressive to smoke or to use drug or alcohol. So, that is a misconception. Now, what is addiction? Addiction is a psychological attachment to certain effects such as euphoria and temporary sense of well-being. With repeated use of drugs, the receptors are responding only to higher doses of a drug or higher doses of alcohol, and this will lead to a greater intake of that particular substance and it will lead to addiction. So, I repeat, what is addiction? Addiction is a psychological attachment. It is considered as a psychological attachment to certain feelings such as euphoria or temporary sense of well-being. Then what is dependence? Dependence is a tendency of the body to manifest certain symptoms, and these symptoms are called withdrawal symptoms. If a drug of dependence or suppose alcohol consumption, if that particular consumption is abruptly stopped, if that person is an addict, that person will show some characteristic symptoms or withdrawal symptoms, then we say that there is dependence. So, dependence is a tendency of a body to manifest a characteristic and unpleasant withdrawal syndrome if a regular dose of drug or alcohol is abruptly stopped or discontinued. What are the symptoms for withdrawal syndrome? The common symptoms are anxiety, shakiness, nausea and sweating. Now, we are going to analyze the different effects and warning signs of alcohol consumption or of drug and alcohol abuse. First of all, excessive dosage. Excessive dosage will lead to reckless behavior, vandalism and violence. Immediate effect will be going to a coma or death sometimes due to respiratory failure, heart failure or cerebral hemorrhage. And also you can see some warning signs. These warning signs are very important. If you want to identify a child affected by drug abuse or alcohol abuse, you should know what are the warning signs of drug or alcohol abuse. So, warning signs are drop in academic performance, unexplained absence from school or college, lack of interest in personal hygiene, withdrawal, isolation, depression, fatigue, aggressive rebellious behavior, deteriorating relationships with family and friends, loss of interest in hobbies, change in sleeping and eating habits, fluctuations in weight, appetite, etc. So, all these are warning signs. So, if you are aware of warning signs, a teacher, a good friend or a family member, they are all responsible or they can detect whether a person is affected by drug abuse or alcohol abuse. Here you can see the effect of alcoholism. A fatty liver is formed first. A normal liver is getting first converted into a fatty liver. Because of deposition of fat, there will be enlargement of liver and this condition is called fatty liver. So, after this you can see in the second picture, it is liver fibrosis. So, here the scar tissue forms, more liver cell injury occurs. And in the third picture you can see cirrhosis condition. This is transforming into a cirrhosis stage. The scar tissue makes liver very hard and unable to work properly. So, cirrhosis is a inflammation of the liver. The liver is almost damaged. AIDS and hepatitis B, these two diseases are common among intravenous drug abusers, because drug abusers, when they are taking drug intravenously or by direct injection of a drug into their vein, usually they are not looking for disposable syringes, they are sometimes sharing all those needles and syringes. So, among drug abusers there is always chance of HIV infection and hepatitis B. Sports persons, you can also see they are misusing lot of drugs in order to increase their efficiency, their performance, their alertness, etc. They are using some drugs, they are misusing some drugs. So, misuse of narcotic analgesics, anabolic steroids and diuretics and even certain hormones you can see among sports persons. But there are a lot of side effects for these steroid type of drugs. So, the anabolic steroids, when used by a male or by a female, you can see different types of side effects. Suppose a female is misusing anabolic steroid, what are the symptoms? In the case of a female, the symptoms are masculinization. What is masculinization? Development of male characters, male features, that is masculinization in female. Then increased aggressiveness, mood swings, depression, abnormal menstrual cycles, excessive hair growth on face and body, enlargement of clitoris, deepening of voice. So, all these are symptoms, all these are side effects of misuse of anabolic steroids in females. What about in males? In males, the side effects are different. There will be formation of acants or pimples, there will be increased aggressiveness, mood swings, depression, reduction of size of testicles, decreased sperm production, potential for kidney and liver dysfunction, breast enlargement, premature baldness, enlargement of prostate gland. All these are side effects noticed in the case of male due to misuse of anabolic steroids. Now we are going to the prevention aspect. Here you can see the different ways in which we can control or we can prevent drug or alcohol abuse. First method, avoid undue peer pressure. By this we mean we are not supposed to exert more pressure on a child. A child should not be pushed further beyond his or her limits. We should give freedom for that particular child. So, avoid undue peer pressure. If there is more pressure, more stressful situation, it may lead to drug or alcohol abuse. Then second, education and counseling, a proper awareness regarding problems of drug or alcohol abuse we should give, we should educate or we should counsel them. Then seeking help from parents and peers, close relatives, close friends, they have a very important role in finding out persons affected by drug or alcohol abuse, looking for danger signs. So, as I told you, there are a lot of warning signs. So, you have to detect the various warning signs that are observed and you have to correct them. Seeking professional and medical help. Sometimes we need professional help. Sometimes we need psychologists, we need doctors who will help that person to escape from that particular situation. So, seeking professional and medical help is also necessary. Questions based on this topic. First question, select the feature of benign tumors. You know what are benign tumors? Option A, they remain confined to their original location. Option B, they form a mass of proliferating cells called neoplastic or tumor cells. This statement is wrong because this is applicable. Neoplasm is formed in the case of malignant tumors. So, this statement is wrong. They proliferate indefinitely and loss of contact inhibition. This is also wrong because benign tumors, they are not proliferating indefinitely, and only for cancerous cells we are observing loss of contact inhibition. Normal cells have contact inhibition, cancerous cells have loss of contact inhibition. So, this is also wrong for benign tumors. They reach distant sites through blood and start secondary tumors. This is again wrong. Only malignant tumors are reaching distant sites through blood and lymph vessels to form secondary tumors. And these cells are capable of differentiation. This is also wrong because benign tumors are undifferentiated. So, here our answer will be option A. Benign tumors, they remain confined to their original location. Now, coming to question number 2, adolescence can be considered as, I told you in the beginning, adolescence is a bridge between childhood and adulthood. It is a period between 12 to 18 years of age. So, here first one is true, second one is also true, and the third one, it is a vulnerable phase of mental and psychological development of an individual. That is also true. And adolescence will lead to certain effects like neurasthenia and hypochondria. What is neurasthenia? Neurasthenia is the inability to concentrate or to enjoy things. Sometimes in adolescence period, you can see some problems in children. They cannot concentrate, they cannot enjoy things. They are moving to different activities. So, that is called neurasthenia, it is an adolescent problem. What about hypochondria? Hypochondria is undue concern about health related aspects. So, particularly in the case of underdevelopers, I mean, what is underdeveloper? A person in whom certain characters are appearing late, they are called underdevelopers. So, like development of moustache or development of any other secondary sex characters. If it is late, that person is considered as a late developer. So, late developers usually during this adolescent period, they are having a sort of undue concern about their problem, and it is affecting all their studies, all their activities. So, this undue concern about health related aspects at the time of adolescence is known as hypochondria. Even the formation of pimples in the adolescence period will be a problem for them. So, that is also coming under hypochondria. So, here you can say this statement is true. Neurasthenia and hypochondria both are adolescent problems. So, when you are going through all these statements, here all are true. So, our answer will be option E. Now, we have the third question. Select the incorrect match. Here hemp plant is actually Cannabis sativa. Poppy plant, it is also incorrectly matched because poppy plant is Papaver somniferum. Cocoa plant, it is used for obtaining cocoa, and it is different from coca plant. Coca plant is actually Erythroxylon coca. So, this third one is also an incorrect match. What about the fourth one? Ergot fungus. Ergot fungus, it is correctly matched. For ergot fungus, example Claviceps purpurea. Peyote cactus, that is Lophophora williamsi. Mexican mushroom is Psilocybe mexicana. So, here the first three are incorrect, they are incorrectly matched. So, answer will be option D. Coca plant is obtained from, coca plant is scientifically known as Theobroma coca. Now, we have the fourth question. Psychedelic or hallucinogenic drugs among the following. Hallucinogenic drugs, they are mainly obtained from the cannabis sativa. So, here you can say that marijuana, hashish, and here LSD is also a hallucinogen because it is obtained from Claviceps purpurea. But here heroin and morphine, they are opioids, and amphetamine is a stimulant. So, our answer will be option A. Now, coming to question number 4, opioid receptors are specifically found in our, options are respiratory and digestive tract, excretory system and respiratory system, nasal mucosa and intestinal mucosa, reproductive tract and brain, central nervous system and GA tract. Opioids, they are specifically binding to receptors present in our central nervous system and GA tract. So, the correct answer will be option E. Now, we have the sixth question. Atropa belladonna and datura, they have, they have hallucinogenic properties. The options are, option A hallucinogenic properties, B depressant effect on CNS, suppressive properties, stimulatory effect, sedatory and antidepressant effect. The correct answer will be option A, hallucinogenic property, because these two plants obtain natural hallucinogens, drugs which alter the sensory perceptions. So, answer option A. Coming to question number 7. Which statement is true or false regarding the tobacco chewing? So, we have to analyze each statement and try to find out whether the statement is true or false. So, first statement, increased incidence of cancer of lung, urinary bladder, throat, bronchitis, emphysema, coronary heart disease, gastric ulcer. Yes, that is true for tobacco chewing. Tobacco chewing will increase the risk of cancer of oral cavity. That is also true. Smoking increases carbon monoxide content and it reduces the heme bound oxygen. That is also true. So, here what about the last one? Nicotine stimulates the adrenal gland to release adrenaline and noradrenaline. Again, this is also true. So, all these 5 statements are true regarding tobacco chewing. So, our answer will be option E here. So, with that I am concluding this last session on human health and disease. Hope you have enjoyed this session. Thank you.